Hi, Dr. Kirsch. Very nice to meet you.
Very nice to meet you.
I'm honored to be here. Okay, so we are interviewing Dr. Kirsch. He has a very good curriculum. He has developed several techniques, especially in pediatric urology. So I would like to ask you, what was the biggest challenge in your career while you were developing this new technique in vesico-urethral reflux?
Yeah, so when I entered pediatric urology, there was mostly kind of open surgery available to fix this problem, incision, hospitalization. And then outside of the United States, we heard a lot about this procedure called the Sting procedure, which was a Teflon injection. And it never really caught on because the success rate was about 75% at best, with the best person doing it. A new product came on the market in the early 2000s called Deflux. And they were looking for investigators. And one of my mentors said, here's an opportunity for you to use this new agent. And so when we went to meet with the FDA in Washington, D.C., I remember looking at this picture of the procedure showing the injection site under the ureteral opening and thought, well, why would we do that if the success of the procedure is only 75% and the risk is that you have continued reflux? Why not be more aggressive about it? Risk obstruction, because when you do open surgery, there is a rate of obstruction that has been reported to be about between 2 and 9%. So we started to inject the deflux in the floor of the ureter, inside of it, and our success rate went up very significantly. And then we started to get even more aggressive about it because we really wanted to compete against open surgery. And so when we started to do double injections, called the double hit procedure, we found that the success went up to about 93% and was really no different than it was for open surgery. And so that really changed things. But I could tell you that the biggest obstacle was being a young guy. This was a long time ago, where I was competing against surgeons that some were, chiefs and chairs of different departments saying, this is experimental. This is not what we do. We have something that's tried and true. And now this guy is coming in with this new technique. And I stuck with it. And the way that I armed myself was to collect data. And so I had more data on endoscopic injection than anybody. And we basically showed time after time that our procedure was safe and effective in children. So we continue to do this procedure after 20 years when I first, started to do it.
Okay, very good. So having said that, do you have any advice to the young urologists or for the residents?
Yeah, I think, residents coming out now are, they kind of like recipes and guidelines. And I think, they have to start thinking outside the box. The biggest issue with developing new ideas is that everybody has ideas. It's having the initiative and having momentum. So if you have the momentum to follow through with it, you could really make a good idea into a practical solution. And I've spent my whole career, trying to do that. You could look at any problem within your field and find the parts that don't work well, the parts that you're frustrated about, and say, well, how could I fix that? And it starts off with a little diagram on the back of a napkin, and then lawyers get involved, and then engineers get involved, and then you have something. And so I would say, if you have a good idea, you should stick with it. You can change the way that your patients are being treated, and it also brings a lot of satisfaction to you in your career that you're able to make a difference.
Okay, very good. So thank you very much for the interview,
Okay.
Dr. Andrew.